options. Well, a much more serious concern tonight for many Americans who rely on medication to keep their health from getting worse. Chief National Correspondent Jim Engel tells us drug costs may rise dramatically under Obamacare.
Oddly enough, the new health care law often pays more for treating conditions than preventing them, in spite of its emphasis on preventive care, by reimbursing so little for critical drug therapies.
Everybody involved in the healthcare delivery system knows that if you can prevent a disease, if you can manage a disease, the patient is better off. And it is the more cost-effective way.
But Obamacare raises the cost of drug therapies because, unlike most employer-provided plans, many drugs are not covered by the exchanges until the patient has satisfied deductibles of several $1,000s.
The average deductible on a bronze plan is $5,000, and then on top of that, a typical consumer will also have to pay very significant out-of-pocket costs associated with branded pharmaceuticals.
A study by the actuarial firm Milliman found that drug coverage under the most common silver plan in Obamacare can be 130% more expensive than employer-provided plans, in part because of hefty co-pays, even after the deductible has been satisfied.
They're saying we'll cover a generic drug, but if you want some specialty drug that works better for you, you have to pay more out of pocket, and this can amount to thousands of dollars out of pocket.
An example that we've used is for multiple sclerosis in some of these plans. Even after you reach the deductible, you're still being asked, patients are being asked to pay 40% of the cost of those therapies.
Some worry high copays will discourage patients from taking their medications for chronic conditions, leading to more expensive problems. It may also discourage investment in new therapies for growing problems, such as Alzheimer's, which analysts say will affect 15 million people by 2050, costing $1.1 trillion a year in care. Even a drug to delay the disease would reap huge dividends.
Not cure, just delay the onset of those symptoms by 5 years. You could save $400 billion a year.
Those with employer-provided plans should also be worried because policies in government programs can eventually get adopted by the private sector, meaning these practices could one day affect all plans, including those at the workplace. Shannon?
Jim, thank you.